countries around the world have seen an increase in COVID cases. There are reports of detection of wastewater levels. We can detect in our wastewater of the various variants of COVID, Delta BA1 variants being detected increasingly in South Africa. Testing wastewater from sewers has become a very powerful tool for detecting the mutations in the virus during the COVID-19 pandemic. There's also the growing concern about a new respiratory virus outbreak which has emerged in China just over the last few weeks. But just to find out more, I'm speaking to Professor Cheryl Cohen, head of the National Institute for Communicable Diseases, Respiratory Disease and Meningitis Unit. Good morning, Cheryl. Really appreciate your time. When we're seeing an increase detection in our wastewater, what's it telling us at the moment?
Morning, and thanks for having me. So as you mentioned, when we look for COVID or SARS-CoV-2, the virus, in wastewater, it's just one of the ways that we monitor the virus. And as you mentioned, the way it works is we actually take water or fluid from the sewers and we test them for the presence of the virus. So it's quite an indirect method. In other words, it's not actually testing people who are sick. It really gives us an idea of how much of the virus might be circulating in the community, but it doesn't tell us anything about who's sick and how sick they are. So an increase in the wastewater tells us that there may be an increase in circulation. That there may be an increase in circulation, but it really needs to be confirmed with other methods of surveillance, which look at, are there people actually sick with SARS-CoV-2 in order to confirm whether that signal needs to be acted on or not.
I know two people who've quarantined themselves over this December period. They presented with mild flu-like symptoms, went to their GP, diagnosed them with SARS-CoV-2, and they quarantined and they isolated themselves at home. So we're seeing more detection in our wastewater, but besides those two people that I know, not seeing many people present with symptoms, or what we're seeing in terms of asymptomatic, or what people would probably mistake for a common cold or a common flu, which can present even in summer months.
Yeah, so absolutely. So the way that we monitor SARS-CoV-2 in order to really understand what's happening, as you mentioned, in terms of sick people, is through what we call sentinel surveillance, which is the NICD has a network of hospitals and clinics and general practitioners around the country where we ask them that any person who comes with respiratory illness, can they do a test, take a sample for us and test it for COVID. So we try to do that systematically so that it's not dependent on if the doctor's thinking of it, but really every person with respiratory illness gets a test. And what that tells us is that COVID, ever since the pandemic, really, COVID hasn't gone away. It circulates all the time at low levels in South Africa, and it does have a bit of ups and downs. So sometimes it'll be slightly higher, sometimes it'll be slightly lower, but we never see these big peaks or big waves like we saw before. Right now, in our sentinel surveillance, it's actually, there's a very slight increase, but it's nothing sort of dramatic or more than what we've seen before. But as you say, I also myself, there are anecdotal reports of some people who've had COVID, and so I think there is a bit of SARS-CoV-2 around. There is some circulation, but certainly nothing worrying in terms of any kind of dramatic increase.
With the HMPV virus being monitored in China at the moment, what concern or at least awareness is there, particularly as we live in a globalized world and people travel? There have been isolated lockdowns. I'm sure we've learned a lot from our lockdown or global lockdown about 3 years ago. So what do we know about the HMPV outbreak in China?
You mentioned the HMPV outbreak in China, and I think many people are looking at that. I think obviously everyone, and that's something we do at the NICD generally, right? We monitor the global picture to see what's happening elsewhere, in case there's something that we to be concerned about or prepare for in South Africa. In the case of China, in fact, what is going on is actually not anything untoward or unexpected. I think in some ways social media has sort of blown it a bit out of proportion at this stage, because we know it's the winter season in China. So China is in the northern hemisphere. It's very cold there now, and they normally would see an increase in respiratory disease in winter, as we do in our winter in June or July. And so what they're seeing is this normal increase, which according to the World Health Organization is really not higher than what they saw last year or in a normal year. And then they test people, very similar to us. People with respiratory illness, they're testing them for viruses. And one of the viruses they've picked up is HMPV. But actually, HMPV is a normal respiratory virus. We have it here. You find it all over the world. And in a winter increase, it wouldn't be unusual to see this virus going up. So, in fact, and it's not the only virus they found. They found rhinovirus and influenza virus. So in fact, what they're seeing is what you would normally expect to see in a winter, an increase, and with normal respiratory viruses. So for now, we're monitoring the situation. I think, everyone's always a bit cautious with trying of emerging viruses coming from there, but actually there's nothing to be concerned about. And they do have a very good system for monitoring in China, and they have been reporting very openly about the situation there.
Really appreciate your time, Professor Cheryl Cohen. She's the head of the Center for Respiratory Diseases and Meningitis at the National Institute for Communicable Diseases.